I think the most common reason women come to see us is birth control or vaginal complaints, whether that be vaginal discharge or STD screening or just annual exams, and then obstetrics as well. So we see a good proportion, probably about 60% of our patients are pregnant patients, and so those are a little bit quicker visits where we listen to the baby, measure the fundal height, and make sure that if they need to do any labs or any ultrasounds. So for new patients, we typically see them for about 40 minutes, and so they'll come in and fill out some initial paperwork, and then we'll address the reason why they're there and go over their common complaints, ask them if they have any questions, and depending on what they're there for, sometimes we do an exam and sometimes not. If it's a new annual exam, then we'll go ahead and do a complete head-to-toe exam, pap smear, any screening for STDs. If it's more of a pain workup, then we may order some imaging studies. If it's an adolescent visit, we may just spend a lot of time talking about education and contraception, giving them different options, and then typically for follow-up visits are about 20 minutes. So we do simple surgeries as far as C-sections from the obstetric standpoint, but also gynecological surgeries such as laparoscopy for ovarian cysts, hysterectomies, taking out uteruses, DNCs, and different laparoscopic types of surgeries, and robotic surgeries as well. So we probably interact the most with pediatricians, especially when we're on labor and delivery. The NICU team is amazing here. If we have any babies that we know have some that may need a little bit of extra help after delivery or some abnormalities, the Congenital Heart Center is fantastic. We work closely with peds cardiology as well, maternal fetal medicine, and then internal medicine and our ICU team as well. We get a lot of transfers from surrounding areas. We get a lot of really sick patients. We work very closely with the ICU team for dealing with our more complicated patients. Sure. So obstetrics is really dealing with pregnancy or pre-pregnancy. So these are women that are still in their fertile years. They come and see us preconceptually, meaning they're contemplating getting pregnant or while pregnant. Whereas gynecology is not related to pregnancy, and that includes the full scope of anything from contraception to just regular routine care, heavy menstrual bleeding, pelvic pain, annual exams, and contraception. So the age ranges that I see, because I have the pediatric and adolescent clinic, ranges from anywhere from 2 on up until there's no real age limit. With my younger patients, we don't start doing pelvic exams or pap smears until 21, and so I always start off the visit, especially with a 16-year-old that may or may not be sexually active, that we're just going to talk about birth control. And I think that's a big myth with young girls, is they may not come to see us because they think that we're going to make them take their clothes off or we're going to do some invasive exam. But really, it's just talking and getting them to know us. We love to see patients and they're 16, 15 years old, just to talk about things and to get them to know their bodies. Yeah, definitely. And our older patients, we stopped doing pap smears at 62, but it's important to do clinical breast exams. Some patients, even if they go to their primary care physician every year, they may not be getting their breast exams and pelvic exams taken to feel on uterus and ovaries and screening for sexually transmitted diseases.